Hello, dear aquarists. Today, with a skyline in the back of the new world cities which are arising. And during those periods, we also, in those cities, people like to keep fish in an aquarium. Like it has been known that people living in cities, in smaller locations, apartments, likely are willing to keep an aquarium to enjoy the beauty of the nature. Well, and part of nature is also keeping an aquarium with fish, which are somewhere raised, pond raised, tank raised, and supplied to the market. And as a fish doctor, I work usually with people who are importing fish and dealing with problems, and I'm trying to help them to counter those problems, to prevent losses, and to train the people to for adequate control, which is only possible when you do a correct diagnosis. And a correct diagnosis helps you to define the problem, to discuss with the breeder, the supplier, and to apply the correct treatment in your facility or in your aquarium. So today it's a case about a rainbow, the boesemani, Melanotaenia boesemani, which has a bacterial infection, also a possible fish tuberculosis. And here the fish I show you in an aquarium. You can see in the back here, this one is abnormal behavior. The ones you see moving here in the front are more likely more healthy. You can see in the back, those which are separating from the group here, another one, a black colored, dark colored one. You have to watch for those species because the fish are telling you with their body language and color of their body that something is going wrong, that something is happening. Of course, there are many healthy ones, but it's the very few sick ones which tell you something. And that's, you have to learn to observe your fish, to observe that some are not showing the right color or the right behavior. I recommend you to do that at least twice a day for each aquarium you have, as a pet shop or as an import or even as a hobbyist. And when you see these fish like here in the back shaking like this, look at this behavior. This is not normal how a rainbow should behave. So learn from that and you become more advanced to quickly react, because the sooner you act and apply treatment, the better your results will be. We took out one of those rainbows and we could see here, well, maybe it's not very clear for you to see, but if you look closely, you can see here a red marking, a red spot. And in my practice as a fish doctor, in most cases, when I see a red marking or a red spot like that on the belly, it's usually due to an internal bacterial infection. So let's examine the fish. We took out, of course, the skin scraping, which was not anything special, but the gills looked very bad. Badly damaged gills. You can see here, hardly any lamellae left, all devoured by bacteria. And it was most likely looked like a columnaris infection. Sometimes we cannot clearly observe by using a microscope. That's why we sometimes have to send fish tissues to the laboratory to do a good diagnostic test on the bacteria. Internally in the organs, here at the right, in the liver, we found tubercles. Also here, a large tubercle next to the intestine. And here you see part of the spleen with some melanomacrophage centers, maybe developing to a tubercle. That fish I just examined was a female boesemani rainbow. And we could see that some of the eggs were badly formed or deformed or infected, possibly with bacteria. So what could we conclude? Well, that there are very weak fish in the aquarium, and I would recommend, if you see that, put them separate in a quarantine tank, and if they're very bad shape and suffering, put them asleep with Narcomore Plus. Use an antibacterial treatment, like I showed you, that those gills are so badly infected, and ask your fish doctor for a proper antibiotic or antibacterial cure. And you can also use this in combination with 3 grams of sea salt per liter, which is also very helpful in controlling the growth of a bacterial population in an aquarium, particularly when we talk about columnaris. It will not kill, but it helps in the control, and that the bacteria population doesn't grow so fast, particularly when you combine it with an antibacterial treatment, like from Aquarium Munster, Viromor, which is a kind of bacterial cleansing treatment. Also, or antibiotics, which are recommended by your local fish doctor. At the same time, I keep on repeating, looking for healthy fish is helping with the care of a good fish food. And we developed our Dr. Bassleer bifugal to help for a better repair and generation for bacterial infections with the ingredient fucoidan, which is a kind of natural antibiotic, which helps the fish to fight off bacterial infections. Think about it, that the cause of this problem might have been the breeder or the feeding with infected food. I have several videos on that. Infected food that has too much bacteria inside, particularly live food or frozen food, have a potential risk of having too much of pathogenic bacteria. So watch out when you're feeding a lot of frozen or live food. You have also higher risk. That doesn't mean live food or fresh food or frozen food is bad. No. It's the quality of the food that determines it. That's why we particularly recommend the granulated food, because that is nearly 100% safe if you kept it well and stored it well, of course. But it's produced and checked by food health agencies if we do the proper work for supplying a healthy food. And we are checked regularly for this kind of cases. So this was this case on a rainbow fish suffering with a bacterial infection, which can be handled properly when you start acting quickly, diagnosing correctly, and applying as soon as possible a good treatment. And you will be more successful. Thank you for watching. Because you watched again today, again, you are becoming a better aquarist. Certainly you are.